All right, Mr. Paredes, I'm Dr. Casillas. Nice to meet you. What brings you into the hospital today? Why'd you come to the emergency department?
Estaba en la prisión.
You know, I was in prison, and when they released me, they gave me the insulin, but they did not give me the needles.
So his blood sugar is really high, and so we're going to do some other lab tests and give him some insulin and some fluids to rehydrate him, because he's been getting dehydrated over the last 3 weeks, not having any insulin, and that's the plan for now.
Okay.
Okay, well, we'll try and get things corrected for him, get him feeling better. All right?
Gracias.
Thank you. The ED has been increasingly, higher and higher capacity, like on a daily basis since we started. But we end up doing a lot of the other urgencies and primary care interventions because patients can't get in to see their providers in our community. So you can turn towards mom, okay? Yeah.
South LA is a community that has very little community-based health care. So it's a community that's missing 1,500 providers, doctors, both primary care and specialty care, and is missing all of the other elements of a continuum of care. So that includes things like nursing homes, rehab programs, full-service pharmacy, dental care, so you name it, it's missing in this community.
Patients have less access. There's nothing really else to explain, us seeing 1,000 or more patients per month than we were seeing previously. That's kind of a summary of what's different about our emergency department than a lot of other EDs.
MLK is a victim of its success. And by that I mean, we have an emergency room built for 25,000 people and we're seeing 125,000 a year. Why? Because people know when they come to the hospital, they get high quality care. There is a shortage of healthcare in the community and we're addressing it. And the shortage is massive and the need is great. But the thing to remember is we are succeeding.
We're not seeking publicity for patients to access care through the emergency department. It just ends up being the reality. Like the patients don't have another choice that fits either with their work schedule, because they can't miss a day of work, or they're the only source of income in the family. It gets put off to the point where they can't deal with it anymore and they have to come into the ED.
No, pues a veces ya no puedo caminar.
One of the biggest procedures we do at the hospital is amputations, is because untreated diabetes goes for so long that somebody comes in and that's what you need to do, is amputate them. We want to stop that. We want to get the diabetes before it gets to that level.
So yeah, his blood sugar was over 1,000, which is definitely way off the charts. It's typically, the normal blood sugar is from 70 to 120, so over 1,000 is, it's definitely a critical number.
A lot of what we see with respect to diabetes is new symptoms created by ongoing untreated diabetes for, a significant amount of time. These are things that are normally picked up with routine annual primary care. And so since our patients don't have a lot of that access or aren't seeing primary care physicians on a regular basis, they're more likely to come in with new onset diabetes.
We want to be able to provide people with care before they become acute in order to avoid them from becoming acute.
It's difficult to sustain that and do it well. So, that's why this need for additional outpatient infrastructure is so important, to maintain what we've started.
Our clinics are the community-based arm of our health system. So they play the role of being the place that follows up on our patients when they leave our acute hospital setting, as well as the place where we provide disease management, prevention, and wraparound social services for people in our community.
One of our biggest efforts, one of the things we do here, is people that are seen in the emergency department or discharged from the hospital, we make it as easy as possible for them to get into one of our facilities and see one of our providers, one of our doctors, so that they're not lost to follow up or, left out there on their own, and we can continue to deal with whatever it is, whatever problem they have. Hello, sir.
Hi, doctor. How you doing?
Good. How you doing?
I'm all right.
You been feeling okay?
Yeah, good.
Good.
Everything's good. My sugars are under everything under 111.
I wish all my patients were like you. You're amazing.
Thank you. Thank you.
How have you been doing it? So Justin is, the classic patient of ours. He went to the ER, wasn't feeling well, had a really high blood sugar, did not know he had diabetes, so was diagnosed with diabetes in the emergency department, and came to us because we do the follow-up for the emergency department, or we try to get people in to do that.
Whenever I went into the emergency room, they would always have a follow-up appointment, always ready for me. So that's what I felt confident about. If I can go ahead and do this on my own, then, they can see it, they can help me do it even more, which they did this time that I've been diabetic, and I still am diabetic. They've made it a lot easier for me.
He's been somewhat of a unique patient in that he's been incredibly responsible for himself. He changed his diet completely, started exercising, has been completely compliant with medications, and very quickly got his blood sugar down.
The overall care that I've gotten from Dr. Meehan and the people from MLK is overall outstanding for me. I love the way that they've taken care of me.
The outpatient settings are critical to our mission and critical to our future.
We started them because there's a huge gap in care in the community, and because our mission is to improve the health of our community. Taking care of people's needs for prevention and disease management are critical to maintaining their health.
I honestly never thought I was going to live past 25. And when I hit the 25 mark, I was ecstatic. Such a blessing that I no longer have to worry about injecting insulin whenever I wake up or whenever I go to sleep, just so I can regulate my sugars. Now I just wake up in the morning, check my sugar, I'm good, eat my breakfast, get out the door.
It's good policy to take care of people, to provide quality care in the community so that you can save costs and you can be efficient, but more importantly, it's the right thing to do and it saves lives.